Good evening. It's no secret that the population here in the Maritimes is growing older, and that's leading to increasing concerns about care for the elderly in our healthcare system. Nova Scotia, for example, has a high number of seniors, and healthcare for them can be complex and costly. A new study conducted at this region's largest hospital promises a simple way to predict serious, even fatal health changes in the elderly. A Halifax doctor says he's found that worsening mobility and balance in those over 65 can predict a higher risk of death. Tonight, Global's Maya Aswad with the exclusive details.
More than 26,000 seniors were admitted to hospital in Halifax last year, most going through a barrage of tests and scans after admission. But according to Dr. Kenneth Rockwood, there's one crucial test that's been missing.
When an older person is very ill and they come into the hospital, it's really important to pay attention to how well they move, because that may be telling us the most important information there is about what their overall prognosis is.
In a new study released today, Rockwood says testing balance and mobility in patients over 65 can reveal which patients are at higher risk of dying. The study, which followed 409 seniors admitted to hospital, found that about 70% of patients whose mobility and balance worsened in the first 48 hours after admission were 17 times more likely to die within 30 days. A finding that's crucial, he says, for two reasons.
A, it beats all the current technology that we have. And B, it helps get at what is an important clinical problem.
That problem being that these tests aren't being regularly conducted in hospitals. Bill Van Gorder is with the Canadian Association of Retired Persons.
This kind of testing should be done in the patient's doctor's office. If they live in long-term care facility, it should be done there. It is a true indicator of the general health and state of the patient.
The province's health minister wouldn't say whether the government would review this research, but says the province's fall prevention strategy is already looking at different studies into senior health care.
When seniors have complex health care problems, they require a health care system that can respond in a different way than perhaps our health care system did in the past.
Dr. Rockwood says his study is now being conducted in Buffalo, New York, and China. Maya Aswad, Global News, Halifax.